Before starting medications like Wegovy, Ozempic, or Zepbound, there are certain labs your provider should check, and a few that are often misunderstood or over-ordered. Today, I will walk you through which labs actually matter, when they are usually checked, and what monitoring looks like once you start. Hey, I'm Lucy. I'm a hospital clinical pharmacist. I help patients understand their medications clearly so that they can make informed decisions and advocate for themselves. This video is for educational purposes only and not a replacement for medical advice. Labs aren't about fear or over-testing. They help establish a baseline, identify risk factors, and make future symptoms easier to interpret. GLP-1 medications are generally well tolerated, but nausea, vomiting, or reduced intake can affect hydration, kidney function, and nutrition. Baseline labs helps provider understand what medication related or what isn't, and not every patient needs every lab. What's appropriate depend on medical history, other medications that you're taking, individual risk factors, and how your body responds. More labs does not automatically mean better care. The goal is safe, personalized monitoring. Before starting a GLP-1, providers often order baseline labs. This creates a starting point and helps identify risk factors and give us something to compare against later. These baseline labs include: number 1, blood sugar testing. This includes fasting blood glucose and/or hemoglobin A1C. This helps assess diabetes, prediabetes, and baseline glucose control. This is especially important if you already have diabetes or prediabetes. Number 2, fasting lipid panel. This includes total cholesterol, LDL, HDL, and triglycerides. Weight loss can significantly change cholesterol levels, so fasting lipid panels give cardiovascular baseline before treatment begins. Number 3, comprehensive metabolic panel. This includes liver enzymes such as ALT and AST, kidney function such as creatinine, BUN, and EGFR, and electrolytes. This is one of the most important baseline labs, especially because GI side effects can affect hydration and kidney function. Number 4, thyroid function test. This usually includes TSH and sometimes free T4. Thyroid function plays a role in weight regulation. It is often checked at baseline, especially if there is a history of thyroid disease or unexplained weight changes. Number 5, complete blood count. A CBC looks at red blood cells, white blood cells, and platelets. These provide general baseline health assessment. Additional labs may be appropriate if you have history of bariatric surgery, very low-calorie diets, celiac disease, or conditions that increase risk of nutrient deficiency. These are not routine for everyone, but may be appropriate in certain patients. Monitoring doesn't stop once the medication starts. Early monitoring is important, typically monthly for the first 3 months, then at least every 3 months. This helps catch problems early. Monitoring during treatment includes: number 1, weight and body composition. Providers often monitor weight loss trend, percent weight loss, and waist circumference. Red flags include more than 5% weight loss per month or less than 5% after 3 months. Either one may require dose adjustment or further evaluation. Number 2, blood sugar monitoring. For patients with diabetes or prediabetes, hemoglobin A1C or fasting glucose are monitored at baseline, then every 3 to 6 months. Number 3, lipid panel. Cholesterol levels are often rechecked around 6 months to evaluate treatment response. Number 4, kidney function. Kidney labs should be monitored if patient experience significant nausea, vomiting, diarrhea, or dehydration, especially if you're already at risk for kidney disease. TSH monitoring is important for certain people. If you take levothyroxine or Synthroid, TSH may be rechecked 4 to 6 weeks after starting GLP-1. This is because GLP-1 medication can increase levothyroxine exposure by up to 33%. This is often overlooked, but important. Labs are important, but how you feel matters just as much. At each visit, providers should assess number one, side effects, especially nausea, vomiting, diarrhea, and constipation. Number two, mental health. You should be screened for mood changes, depression, and suicidal thoughts. These are rare but important to monitor. Number three, nutrition and muscle health. Monitoring for nutrition and muscle health includes adequate protein intake, physical activity, and if you are 65 and older, muscle strength should be monitored. These may include sit to stand testing and grip strength. These help prevent fragility and functional decline. Not everyone needs the same labs. The goal is safety, personalization, and avoiding unnecessary testing. If this video helped you, like and subscribe for clear evidence-based medication education. Did your doctor or provider check your labs before starting GLP-1? Let me know in the comments below. Until next time, stay healthy and remember, health is the greatest wealth.